us and taking the time. We are going to have a wonderful presentation today, and we are looking forward to a lot of information, both from the DCF Care Line and our Stanford Youth Services. So let's get going. Today with us, I'm Christine Killen. I'm a consultant at CERC. My colleague, Stephen Proffitt, could not be here with us today, but sends his well wishes, and he is missed. We are also here with Kari Sullivan Custer from CSDE. And we are here, as I mentioned, with the DCF Care Line with Lisa Damont, Ed Eckert, and Michelle LeBoy. But also joining us again today is our Stanford Youth Services, Susan Laria and Matthew Lukowski, Executive Director of Access and Opportunity for Stanford Public Schools. The last thing on the agenda today, I'll just give a very quick wrap up. I don't want to delay anything as we have a lot of great stuff coming forward. Just stay on a few minutes at the end just so we can have the final slides to give you the heads up of what's coming up. I'm taking a quick look at our CSDE Superintendent's Digest, which QR code is on the screen, and we will share the PowerPoints with you along with the link. But some upcoming, some recent information that was put forward. Special Education Excess Cost Grant, kind of that one-time data collection for special education costs. There's also CSDE Groundbreaking Research Collaborative issue, a new report showing kind of that positive effect of home visits and student attendance. I was really super excited to see this on the Superintendent's Digest. It's something, we've been talking about and we've been working with. The LEAP home visits have been fantastic, and it is showing that research and that collaborative with it. We also have this, I guess it's an optional type of a resource, but it's a customizable alternative and conform template for districts not collecting school meal applications. There's also some information here on those kind of COVID test kits, kind of that extension of expiration dates as an information piece, that really the expiration dates on the kits, yes, it's there, but there is some life a little bit after that. And I think that's what covers a little bit in that resource. And how to exactly dispose of those test kits as well, which this is very valuable information. So it's done in a safe way. Quickly too, there's a model enrollment policy that you could look through if you're interested. Also 23-24 State Board of Education student member search. They are looking for student representation, which I love to see. It's a real valuable asset to the state board. And then there's also the Connecticut students are selected United States Senate Youth Program. And quickly, CSDE has launched a new Bureau of Certification website, so take a look if you have a chance. The Office of Civil Rights has also released a new fact sheet on Title VI protection for discrimination based on shared ancestry or ethnic characteristics. And then, of course, the Prevention Month for January 2023, Department of Children and Families put out some information on human trafficking. And last but not least, the CT Department of Motor Vehicles kind of annual Teen Safe Driving video contest is something that they launched. So again, the QR code and the website link is here if you're interested in any of these, but these are also, once you get the PDF, you could click on the links here and it will direct you right to the site. I will turn this over to Kari.
Thank you, Christine. And I'm going to go pretty quickly because we have a pretty full agenda today. We invited DCF and Stanford Youth Services back because we didn't have enough time in the first session. So we're having a kind of a booster follow-up session to answer questions and cover everything that we weren't able to cover in the first session. So we're glad you're here. And so I'm going to go through these quickly. There's a lot of information, but you will get these slides. And so you'll be able to look at it in more detail once you get your slides. So looking at chronic absence data, if you were on Talk Tuesday, 2 weeks ago when the next slide, please. When the Performance Office presented on EdSite and the monthly data collection for attendance, we shared the November 2022 data. We don't have December yet, so we still have the November data. And you can see that overall student engagement or student attendance, these are specifically chronic absence, is up since last June. Many of our groups of students are coming down. These are the high need students. We've seen them come down since last year. They're going back up again. We know because of all the respiratory illness and things that are happening in the schools. Fortunately, I think the respiratory illnesses are coming down a little bit, so we might get a little reprieve from that. But one thing that's interesting to know is if you look at students without high needs, you'll see pre-pandemic, their chronic absence rate was 5.9%. And in November, it was 17.6. So while our total population has doubled, our non-high need student data has tripled. So this population of students who we generally weren't concerned about attendance are being impacted by whatever's happening in schools around illness, mental health issues. It's crossing over between across all students. So just want to call attention to that so that you're aware. And so with that, we have a lot of districts who are addressing attendance who never had that issue before as well. Next slide, please. This is a new slide from AttendanceWorks that helped us to develop this, and it shows chronic absence by grade level. And what's really kind of surprising here is chronic absence in the lower grades has gone up since the end of last year to the fall of this year. This is November data. You'll see kindergarten is up significantly, first grade, second grade, third grade. It starts to even out a little bit in fifth, sixth grade, seventh, starts to really go up in the high school, especially grade 12. I'm not sure if that has something to do with locating students and figuring out formally what's happening with them. Grade 9, you'll see is coming down. I know there's a lot of attention on grade 9 in many of our districts, especially our LEAP districts. So just want you to be aware of this. Do you know what your data looks like in your district? You can look at the monthly data reports on EdSite and find your own district's monthly data. And so that you can look at it this way and see, are you seeing these same trends in your districts? And why do you think we're seeing these trends right now? The next slide, please. So the Learner Engagement and Attendance Program, LEAP, next slide. Tell you a little bit about LEAP. LEAP is about relationships first. This was launched in April of 2021, when right in the middle of the pandemic, when we realized from our monthly attendance that we had districts that were significantly impacted by the pandemic and their attendance. And so there were 15 districts selected, and they focused on home visits. It was through a partnership with the Rest Alliance. All LEAP home visitors that are trained through our LEAP 101 training at CREC. The home visits are targeted tier 2 supports for students and families who are disengaged from school. So those kids who are around 10 to 12% chronically absent right now, maybe 50%, those kids that we can still bring back into back on track with attendance. There's scheduled opportunities for 2 members of community partners, the school or community partners, to go to the home and visit with the family. The conversation is focused on family strengths and capabilities, as well as their aspirations for their child. I like to say, before talking about grades, behavior, and attendance, we ask, how are you? What can we do to help you to support your student going to school? Families receive generally 2 to 3 home visits to help build support and relationships over time. And we found that credible messages are key to success. And so the LEAP evaluation was released last week, and I'll tell you a little bit about the findings, but we're going to schedule a more in-depth discussion on LEAP in the next couple of Talk Tuesdays. So next slide, please. The key highlights from the report, and this can transfer to other home visit programs that are using the LEAP approach to home visiting. So for most students examined in this study, attendance rates increased by 4 percentage points in the month immediately following the first LEAP visit. 9 months after the first LEAP visit, students in pre-K to 5 experienced approximately an 8% percentage point increase in attendance. We saw students in grades 6 through 12 saw a 16 percentage point increase in attendance 6 months after the first home visit. So we really saw improvements in attendance from these visits with families that were relational and positive, and about how can we support you instead of truancy and shaming and that kind of thing. So So the study suggests that the impact of LEAP was significantly larger in later grades. Results do not differ based on the type of personnel, school or community-based, conducting a LEAP home visit. Most home visits prior to the LEAP, most research prior to the LEAP home visit studied teachers doing home visits. This research study looked at community-based and school teams, other people from schools doing the home visits, and found they were having the same success. So there was 9 months after the initial LEAP visit, it increased by approximately 15 and 20 points. We saw a significant increase in Harvard. With their LEAP program, they saw a 30% increase in attendance 9 months after the first visit. There is one other big difference. LEAP visits that occurred at a student's house or a student's school, or a face-to-face visit at a coffee shop, on a porch, in a library, had significantly larger impacts on attendance than LEAP visits that occurred virtually on the phone. They did not have nearly the impact if it was a phone call or Zoom than if you met the family in person. We realize that's not always possible, but it should definitely be the preference and first choice. Any questions around LEAP, please put them in the chat and I'll respond to them in the chat, and then you can always contact me. Next slide, please. These are some slides from AttendanceWorks around effective messaging with families. I'm getting lots of calls from families about these letters that are going home, and the state requires letters after 10 absences, which isn't true. And the letters are scaring parents. They're very heavy in statute and kind of blame. So I wanted to share these resources with you and ask you to please review your letters that you're sending home to parents, and make sure that you look at them from the parents' perspective, especially for parents who may have had children who have been sick and impacted by COVID. I realize there's things you have to put in the letters legally, but let me show you some of these resources that might be helpful. Next slide, please. Forging partnerships with families to support engagement attendance. So the letters should be, any communication should have supported messages throughout the year. They should provide tailored, personalized, and caring messages to students and families who are chronically absent. They should offer actionable steps to improve attendance. Like, here, we realize that you've missed 8 days because your daughter had COVID. Here's what you can do. And it's really important that you have good attendance going forward for the rest of the school year. And contact us. Contact the nurse if there's illness or sickness, so that we can all know and understand what's happening. Make sure families know what resources are available for basic needs as well as learning at home. Next slide, please. This is some research from Todd Rogers at Harvard University. Dr. Todd Rogers, he helps AttendanceWorks develop some resources about what the letters should look like. They should be readable. They should have fewer words. You should look at the Flesch-Kincaid readability test, which is in Microsoft Word. See what grade level are you writing these letters at. Skimmability, bullets, format reinforces message. So programmatic, they're planned, they're timely, they're routinized, and easy to locate, and multiple modes of communication. So if you have a system at your district where after 10 absences, no matter what time of the year it is, a letter goes out, that might not be individualized or personalized, or might not be helpful to families, depending on what part of the year it is or what's happening with that student. So you may want to consider when and how letters are sent. Next slide, please. Better truancy notifications. There's a link here to understand, what this is research-based. What resonates with families so that it improves attendance, starting with positive language, and they move the punitive language to the end. Fewer words, written at 5th grade level, formatted to help readers skim, and makes the connection between absences and achievement, not absences and shame or blame, and understanding. Next slide, please. This is a couple of resources. There's a chronic absence letter, sample letter from AttendanceWorks. There's their recently updated winter messaging toolkit for how to message with families about issues related to weather, travel, and other things that impact attendance in the winter. And then there's this research on text messaging, which with parents, and evidence-based approach, because we know more and more districts are using text messaging platforms. Next slide, please. And that's it for me. So if you have any questions, you can contact me directly or put them in the chat. And at this point, I'm going to turn it over to Lisa Damon from DCF Careline. Thank you.
Great. Thank you, Kari. And good morning, everybody. I'm glad and happy to be back. Hopefully, last time I provided a lot of information, and this time I'm going to do a brief overview of what I previously talked about. However, if you have questions, I believe you're putting them in the chat. Is that how it's working, Kari? Or Christine?
Yeah, chat box works. Also, when it comes to maybe when we open to Q&A, there is the raise hand feature. But for right now, as we go through the information, chat box would be great.
Please forgive my dog for barking. I apologize. I tried to mute it really quickly, but she apparently is barking at something that she hears outside, which she frequently does. Next slide, Christine, if you could. Great, thank you. Before I start on the slide, I really want to talk about and share a little bit of data with you all. I did not put it in the slide, but as Kari was talking, I said, you know, this might be a good opportunity to talk to you a little bit about the data. Last year, this past year, we received 64,000+, almost 64,500 reports of abuse and neglect. Of those, 86% are from mandated reporters. And I want to let you know kind of where you sit as far as mandated reporters. You are the largest mandated reporter that makes reports to DCF. At about 38% of all reports received are from schools or school personnel, followed by police and followed by then mental health professionals. I say that because you see children every single day. You have relationships with them and with their families. And you have the most access. So one would, it's accurate that you would think that most of the largest mandated reporter would be all of you, because the children are spending 6+ hours with you every single day and you're forming relationships with them. So I wanted to share that data just so you see sort of where you're at as far as making of reports. Today we're going to focus on educational neglect, what it means, and excessive absenteeism. So, when we look at educational neglect, we look at the age of a child, right? So we look at, for children school age to 12, that excessive absenteeism may be indicative of a parent or caregiver's failure to meet the needs of the student. And then we look at children older than 12 and looking at excessive absenteeism coupled with a failure of a parent or caregiver to engage or improve a child's attendance may be indicative of educational neglect. So it's that age, right? The age 12 and up, we're looking at, is this truancy? Is it educational neglect, excessive absenteeism coupled with a parent's failure to engage? So that's how we are defining and looking at educational neglect. And, the considerations that I talked about, then when we think about this, are age, health, level of functioning, academic standing, and a dependency on a parent or caregiver. Does the child depend on the parent caregiver to get them to school? 7, your 8-year-olds, absolutely, they need the parent. 12 and up, are they going to the bus and then not getting, or going to school and then walking out the back door? So that's how we're looking at, and when we're assessing. So we need information that relates to those various things when you're making a report. And determine excessive absenteeism, the following characteristics of the parent or caregiver are considered, right? So when you're calling in a report of excessive absenteeism, what are the things that you've done? Have you engaged the parent? What is the rationale provided for the absences? What are the efforts to engage and communicate with you and with the parent? And any failure to enroll the school-age child in appropriate educational planning, including homeschooling. So we're looking at those factors when we're assessing criteria for educational neglect. Next slide. I like this slide. I try to use this one a lot. The three things that we look at, right? Age, like I already said, school efforts and parental response. Those are the things that we take into account and we need in order to determine if it's an educational neglect referral for acceptance. Again, I've already talked about this, the age of a child. So in this, I've listed a bunch of bullets. If you go to the second bullet, efforts need to be made by the educational provider to engage the parent. I'll say it again, engagement, supporting. Those are the things that are really, really important for not only the parent, but for the child. How we engage, what's happening, what do they need? How do we support them to get the child to school on a regular basis? Efforts should be progressive, more aggressive and documented and demonstrated. And it may be neglect if there's no response. So I want to just continue to reinforce those things. A parent's disagreement, in the next bullet, a parent's disagreement with educational plan is not neglect. A parent indicating the family is in crisis and not prioritizing educational needs currently, but has plans once stabilized is not neglect. We put this bullet in when we were early on in COVID, when parents were really struggling with family members becoming sick and trying to get the kids to school and they weren't working and balancing that work life. Well, that still exists, right? We've had RSV, flu, and COVID this year, things and the stressors of a family, like what is really preventing them from getting their child to school, and how can we be of a support, or how can you be of a support before making a referral to DCF? What are the things that you've tried? A parent has told the school that they are homeschooling with their own curriculum while schools are closed. Well, that was from COVID, so that was not necessarily neglect. And a parent not having the resource, has all the necessary resources, has provided no explanation for the elementary age student's lack of participation or attendance, and is not engaging with the school, that may be neglect. So we did put that last bullet in to kind of highlight those things. After all those things that you've tried and there's really no response, that may be neglect. All right, next slide. And I like this one. I mean, we've had these slides out probably for a couple of years now. I like to show these because it really talks about when to make a report to DCF. Mandated reporters are required to report or cause a report to be made when they're in their ordinary course of their employment or profession. They have reasonable cause to suspect or believe that a child under the age of 18 has been abused or neglected or an imminent risk. I put this up, and we're going to talk about it in a few minutes, the portal. Right. So back in 2018, we rolled out the portal when we were having significant call volume wait times at the Caroline. We rolled out the portal. It was only for schools. It was a pilot. We eventually added additional opportunities for some other mandated reporters to use. And now, as of June 6th, we rolled out our mandated reporter non-emergent, oh my God, our mandated non-emergent reporter portal. Apologize, a lot of words. And we rolled it out. It was for all mandated reporters. It is active. It is up and running. We have sent emails to all the superintendents, as well as our other providers. And we have the portal, and we have seen an uptick. So I do want to say that in filing online. And I want to say I greatly appreciate that non-emergent reports are being filed online. So, I outlined in this this slide when something's emergent and when something is non-emergent. And the portal will actually walk you through whether it's non-emergent, and it prompts you. So we will talk a little bit about some of the other enhancements that are coming up, and I'll let Ed do that in a second. But just to point out, I like the cogwheel. It kind of explains reporting, ages. So it's just really additional information for you in a one-page document that you could always refer to. At the bottom of the educational neglect, the bottom part of the paper on, I think it's my right side as I'm looking at it, if you look at the last asterisk, for children older than 12, excessive absenteeism through the child's own intent, despite the caregiver's efforts, is truancy, which is handled through the school. So I really wanted to point that out to you. And I think I've covered everything in this slide. I don't know, are there any questions in the chat yet? No? Okay. Okay, I just want to double check. Certainly if you, as you put them in, I can always jump back on and talk about it, but I'm going to turn it over to Ed on the next slide because we really want to talk about the portal. And since going live with the portal on June 6th, we recognized that we needed to do some tweaks or enhancements. So Ed, I'm going to let you take it away.
Thank you, Lisa. I'm going to begin sharing my screen, and Lisa's talked a little bit about educational neglect, truancy, and some of the things you should really be considering. And those efforts can definitely lead to now having to make a report. I am having a hard time sharing my screen. I don't know if it's an access piece.
Let me check for you, Ed.
While they're doing that, I think it's helpful to sort of explain that, this non-emergent portal, very accessible, very user-friendly. And now this gives your opportunity to your staff to give us some of that information regarding those efforts, those phone calls, those letters, those meetings, the parents' response to you for all of those efforts. When you're making this non-emergent report from the school system, if it is around educational neglect, failure to register a child, something that doesn't need emergent response from DCF, this is where you're able to now do that. And some of the questions are there basically to allow you to give us that information so we can make the best assessment possible on our end. Oh, now I'm able to share, it looks like.
So Ed, you have about 10 minutes. I think that's where we're at, right, Christine?
That is where we're at. Yes. Thank
Okay.
you, Lisa. Yes.
Great.
Maybe about 8 minutes. I had to check my clock.
I'll make it 7. So can you folks see my screen now?
Yes, we
Yes.
can. Yes.
Great. So I know someone asked about, the slide deck that Lisa presented. The easiest way for me to articulate how to get to this portal is just go to Google, DCF CT, Connecticut, whatever. This will bring you to our main website that's open in the community. And we have a link right here for the mandated reporter portal for non-emergent reporting. This is what it looks like today. This is on our production. We have 2 different sort of apps, just like you would have on your cell phone. This is the portal that which your staff can go in and create an account that is unique to those specific mandated reporters. What I'm going to bring you over to is this other tab, and this is a little bit of a look behind the curtain. We have created some enhancements. If you've already experienced this mandated reporter portal, we're adding some bells and whistles to it from the feedback we've heard from schools and doctors and other mandated reporter entities. The functionality, the purpose of the portal is the same, but what we're giving you now is the ability to see submitted reports. When a user logs in for the first time, they'll see their name, or when they go back to the portal, they'll see their name, and then they're going to see a list of all the CPS reports that which they have submitted. If I had 8 prior submissions, they would all be documented and shown here with some of the data points. What I have mocked up for you is an in-progress CPS report, and that's one of our newer enhancements. That's pretty. We're excited to give this to you folks. Say a mandated reporter's typing up a non-emergent CPS report, and all of a sudden there's now a fire alarm. No longer would the mandated reporter have to worry about completing it in that instance. You can now save your CPS report and come back to it at a later time. So what I'm going to do is I'm going to click into a in-progress CPS report, and you'll see it's regarding a child that I've already entered some data points on. It's starting to capture some data. The status is in progress. Any in-progress CPS report is not being sent our way just yet. That is only done once you've actually submitted the report. But very easily they can go in, and it's going to bring them directly back to the last spot at which they saved the CPS report. I'm going to go over to the beginning, and Lisa talked a little bit about the portal guiding you. We have a series of questions here that we're really trying to weed out any any confusion, maybe a mandated reporter is a little confused about, hey, is it emergent? Is it not? Should I use a portal or should I not? This very first tab, the disclaimer tab, we're trying to make sure that the people that are using this portal are in the right avenue. It's going to tell you if you're in the wrong spot. For instance, if I'm down in this report is regarding sexual abuse. You have a mandated reporter where a child disclosed to their guidance counselor sexual abuse concerns. That's something that we don't want submitted through the portal. Rather, if they come to this question and this is a yes, they're going to be told right off the bat that, hey, this is an emergent or we need an immediate sort of assessment from the department. And we're asking you now to call the DCF care line. Something along those lines, a user wouldn't be able to submit something of that magnitude, sexual abuse, a child afraid to go home with a child presenting with significant physical injuries that are indicative of abuse in some way. For the purposes of the demo, though, I've sort of mocked up a bunch of different tabs. Let me move this to this side. And information. In this case, we have the next information that we're capturing is about you, the mandated reporters. A lot of these data points are now being stored. So when your users come back here to submit another CPS report at a later date, the information about their name, their email address, their phone number, where they work, their contact information, we're now storing that on the portal to help speed up their submission process, because they'll just do it that first time and they come back, the system's going to know and recognize it after they've logged into the account. Here, you're starting to capture information about the adults. So I have just a mocked up adult that which I put in here. We have Jill Mother. She's the birth parent. Any information that you have relative to the adults, and not just the parents. Let's say there's an uncle in the house. That information is helpful too. Let's say the report is in regards to a neighbor maltreating a child in some capacity that, you would be to this portal. Those individuals that are guardians, custodians, parents, suspected of causing the maltreatment, all of those unique individuals, we're asking to submit that information here. And you're able to do so one at a time. And it helps us to make the best assessment possible relative to, how we're going to respond to your inquiry. Same thing with the children. If you know that there's siblings in the home, share that information with us as you're doing this. If this is a report regarding multiple children, maybe two different households, maybe this is something that happened in a school, adding each of those children as well will help us understand and determine where to go with the next report. Then we have a series of general questions. Some of these will also stop you, meaning, if you start answering the system regarding physical abuse, injuries to a child, it's going to say, hey, stop now. This doesn't appear to be non-emergent. Call the DCF care line. In this scenario, I basically have a scenario where a mother of a 9-year-old has never had the child enrolled in a school system, comes to an elementary school today and says, hey, I want to register my child, who's had no prior formal education, no prior homeschooling. Unfortunately, these sort of scenarios do bubble up at times, but knowing the audience, I wanted to sort of craft a scenario for you folks. Just a series of questions. We also have additional questions relative to unique mandate reporters. So in this instance, we have the ability to ask school systems specific school-related questions: children's vulnerability, functioning, how the attendance is going, any issues with social emotional, how do the parents respond to the school system? So when Lisa talks about efforts, let's say you've held a series of meetings, the parent has not come to any of them. They've responded to the school system in a way that you have some information on that. Sharing that here helps us understand really what is happening relative to the attendance and gives us a keener understanding of the scenario. The portal also has additional questions that the mandate reporters can answer regarding intimate partner violence, human trafficking, substance misuse, again, specific to those elements.
And if I can just give you a 1-minute warning, please.
Perfect. Thank you.
Mm-hmm.
Then, we know mandate reporters have the opportunity to ask to be anonymous to the family, not to us per se, DCF, but you have that option here. Tell us anything else you think we didn't ask here. There's sort of like a last question there. And then one of the next really nice things about our portal is we have attachments. So let's say you have a series of letters, series of an attendance. Maybe you have attendance records from the last, say, 5 years you want to show, because now you're showing a pattern. Any sort of supporting documents that sort of can give us a picture of your efforts, the parents' response, you can now add those to the Mandated Reporter portal. Can't do any videos, but you could do PDFs, documents, photos, Excel spreadsheets, anything like that. That helps us better understand what is happening with the family. Your final page is, basically you can go back to any of these tabs. You can edit it before submitting. And then you'll just sort of check that I'm ready to submit. And at this time, our last thing I'll say is at the time of submission, all of Mandated Reporters have a one-time opportunity to review and view, save the submission that which they just sent to DCF. They can download the PDF. And here is every single question and all the answers that Mandated Reporter submitted to DCF regarding that one unique scenario. And they can now save it, they can print it, they can store it for their records. This is a one-time opportunity because there's laws and requirements we have to follow regarding record retention and record requests. But because this is the one and unique opportunity, this is a great scenario where these individuals your folks can now have this on file for themselves for a later time if they wish to go back to it for any other reason. I'll stop sharing.
Thank you so much. I think one thing that I want to point out that's really helpful with this, because that is just such a detailed overview of how to use the system and the new features, is this is recorded. And so you can take this recording and share it with your staff in your schools, or if you have home visitors or folks that you want to be aware of this new system, take this recording. I'm going to post it up on Talk Tuesday, in the next couple of days. And just show it in one of your staff meetings, show sections of it. Don't let it stop here, use these resources. Say Ed and Lisa, that was awesome.
Great.
Last
Thank
thing I'll
you.
just quickly say is that these enhancements that I showed, some of these will be going live to the community in February. So that's our target period.
Thank you.
Thank you. If I can add one more thing, last slide on my PowerPoint presentation are some phone numbers of myself and my staff. And thank you very much for the opportunity to talk today.
And we're going to have questions and answers at the end, right? So you guys are going to stay, think of some questions. Thank you. And now we're going to turn it over to Susan Lauria, right, Christine?
Yes, we are. So we're turning over to Susan and Matt. So go right ahead, guys.
Can everybody hear me okay? And hopefully you can see our opening slide with the two blue squares.
No,
Can you see that okay?
yeah.
Okay, hold on. Can you see it?
Yeah.
You got it. Okay. So Susan and I are here today to present to everyone around some positive interventions that we utilize here in Stanford for our students, and also really highlight the intersection between Stanford Public Schools and the City of Stanford's Youth Services Bureau, and how we work together to support students with chronic absenteeism as well as truancy. And I think us presenting along with DCF makes a lot of sense, because utilizing some of the systems that we've put into place will give a good format and framework to exhaust a lot of things before making a referral over to DCF. So we have implemented an initiative, and we started off with our middle schools this year, and I believe we touched on this back in November. And so really it started with each school assembling an engagement team. And so schools had the autonomy to determine who they felt would best serve on these teams. However, oftentimes it is made up of a lead, could be an administrator or another designee. Oftentimes school counselors are on this and some other support service folks. Using PowerSchool, they will run reports that we've created to help identify students who we want to target. And typically we look at truancy and our chronic absenteeism reports. And one thing I just want to highlight at this step is to be efficient with who we're going to move forward and really target, we want to look at those reports to weed out students who may be listed as chronically absent, but we know that they may have been out because they've had the flu or COVID. And so even though we don't want to forget about them and lose sight, we know that there's a reason that has led to their percentage rising above 10%. And so we're going to keep our eye on them, but we're not necessarily going to move forward with this full intervention initiative unless they continue to remain as a chronically absent student. So once we've weeded out and filtered through our reports, we then will assign students to team members. And that could be adults who know the students well, oftentimes it's school counselors, could be, we also have family advocates who work in the building. And so we try to spread it out so the numbers are reasonable for these adults to work with these students and families. And the last time we were on, we really touched upon the leveraging of an inventory that's called the Reasons for Chronic Absenteeism Inventory. And so this helps us collect good information from each student on what potentially is causing them to be absent. Then we analyze those results, and then we look to implement support for individuals as well as groups of students that fall into similar categories. And when we're looking to do that, we do like to consider the sphere of influence to determine what can be supported at the school level, and then what should be referred to Here to Help or Susan and the Youth Services Bureau. And so this is just a quick snapshot. You can access the Reasons for Chronic Absenteeism survey online. If you just Google that, it will come up. There was an initial survey that was created, I believe, in 2017. You'll see the citation. However, there was another one that was just amended during COVID. I find that the 2017 version is more applicable now, now that we're not really offering remote or hybrid learning. And so this is like a PDF copy that has several questions, and this is just a snapshot of what some of them look like. We have taken this and weeded it out. So we have added questions that we find to be useful, specific to Stanford. And there's other questions that are on here that make a lot of sense to utilize. And we have created a Google form just because we feel like it gives us really good data at a snapshot. And so here's just a quick example of two items that I put. So one of the items is I did not feel safe attending school. And just so everybody knows what the color categories are, green is never, yellow is rarely, red is sometimes, and blue is usually. And so typically if we see a question that has over 75% of the responses are never, that's not something that we're going to look at school-wide or for that big, large number of students. You can see 56 students at this point took the Reasons for Chronic Absenteeism survey, but we might follow up with individuals depending on why they may or may not feel safe. Now, the other one, no one misses me when I don't attend school, you can see that had 55% who said never, but the percentages of students who said rarely, sometimes, or usually were higher. So that might be something that we want to look into on a broader level. And so I included this slide because this is from one school who collected those 56 responses after going through that protocol. And just, some notes, they collected 56 responses, 60%, almost 61% were Hispanic, 80% were non-ELs, 57% of the students ride the bus, 38% do not. And there is a question that asks if the students feel like their absences are comparable to other students, and 45% of the students surveyed felt like theirs were. Some of the trends that were polled, short-term medical, so 41% responded usually and 39% responded sometimes. So that is something with RSV going around, with flu and with COVID. I think that's something we all are experiencing. Sense of belonging had some elevated responses, both in the usually and sometimes. Staying up late, usually and sometimes, we're at 26%. School is boring, usually 25%, sometimes 32%. And no one misses me, usually 12.5, and sometimes at 16%. So some of the ideas that this particular school team is working on, so to address the sense of belonging and the no one misses me items, the admin team is working with staff on a school connections initiative. So they're really going in and doing a school connectedness inventory to identify students who may not have connections with at least one adult, and then developing action plans to forge connections with those students. For the short-term medical, looking to connect families with the school-based health center. So fortunately for the school, there is a school-based health center on site. And so holding a meeting with the family and a representative of the school-based health center can be helpful to help the family and the student understand what they have access to within the building, and hopefully get on top of some of the medical needs if possible, so they can receive support right at school without having to necessarily go home. And then some of the things for staying up late, work with families to establish night and morning routines, help students create routines with their phones. We know students, particularly middle school age students, use their phones quite a bit. Work with our TIS, so that is a position we have in Stanford. It's called the Technology Integration Support Specialist, to help support parents on setting limits on student technology within the home. And then we would look to make a referral to Susan and Here to Help, which could help set up home visits and other supports. I see, Kari, you have your hand up. Go ahead.
There's a question in the chat about, is this a standardized survey, or is it something that Stanford created?
So as mentioned, this, I think I talked about this in November. I was only on for a short time. I was at a National Association for School Psychologists conference in, I think it was February of 2020. It was just before the pandemic really hit. And there was a presentation I was at where this survey was utilized. So it's standardized if you pull it like Google. If I go back to that original slide, this one, if you Google reasons for chronic absenteeism, it will give you the full survey that has been developed by, I believe it was the University of South Florida. We have taken that as our foundation, but we have edited it to be more specific to our needs here in Stanford. And we also, the survey as it is from the website is really just a PDF. We wanted it to be in a Google form so we could get that quick data collection.
Thank you.
Whoops. And so really that is going to be my transition over to Susan to talk about, once we've exhausted all of these steps at the school level and district level, we then would lean into outside agencies, outside resources, and really work through Susan to help us with that. So Susan, I can keep presenting if you want to talk. Just let me know when you would like me to move forward.
Great. Thank you, Matt. So good morning, everyone. I'm Susan Lauria, and I'm with the Stanford Youth Services Bureau. I work very closely with Stanford Public Schools. And what we're just sharing right now is one of our home visitors, Katia Pazmino, participated in a press conference with the governor. And we use LEAP to the LEAP format for chronically absent students. So what does that mean? That it's a relational, positive visit. We meet with families to say, how can we support you? And we connect absences to achievement. So she's just highlighting two cases here from, I think they might have started last school year, have continued this year. They're pretty extreme cases. One of them was a very young middle school aged pregnant mom. And the other one is an elementary school child with leukemia that were chronically absent, as you can imagine, for a lot of health related reasons, social emotional reasons, and we're happy to report that both students are doing very well. Slide, please. I just wanted to, when I first took this job, prior to COVID, so I want to say it was like 5 or 6 years ago. I'm not sure that, Kari, what was the time frame for? It's when truancy was decriminalized, so to speak.
It
And
was around 2015, I believe.
okay, so I came on a little bit after that. And it's also when we started looking at truancy versus chronic absenteeism. And when we're going to talk about the truancy referral process, which was changed to go through youth services bureaus, truancy itself just refers to unexcused absences. We obviously look at chronic absenteeism when we're accepting any kind of a referral. It doesn't really matter if they're excused or not, the student is missing out on education. Slide. So what happened? Yes, I did have this in here. So in 2016, the Connecticut General Assembly passed an act. There was no longer to be doing FOISN referrals. I don't know if I pronounced that right. And they were supposed to go to youth services bureaus. But basically what happened is they took the exact same document, didn't make any changes. They just transferred it to youth service bureaus. So when I came on board afterward and I met with, I think I met with our high school teams first, and I still meet regularly when everything that I do is in very close collaboration with school counselors, school social workers, school administrators, because part of my role, I'm also the coordinator for the district attendance teams as well as LEAP, is to do preventative work as well. So not only am I getting the chronic absentee referrals, we're trying to figure out how we can prevent them from getting to that tier 3. And one thing that Kari often says is if you only focus on your tier 3 students, you're going to get more tier 3 students. So you'll see some of the things we do to try to help prevent students from getting to that point. Slide. We all know why the law was changed. I mean, obviously it didn't help to jail parents, fine parents. It didn't help to get kids involved in the juvenile justice system. It was not providing what families needed, right? Which was connection and engagement, both from the parents' perspective and the student's perspective. Slide. So the youth service bureaus became the coordinating arm. At that point, there were not a lot of referrals. It was a 10-hour-a-week job. Now it's probably a 60-hour-a-week job with a whole team of professionals helping me. Slide, please. We're short on time, so I'm just going to go to the next slide. Oops, right here. So here's everything that we're doing. Kari specifically asked me to address the tier 3 referrals today for kids that are extremely chronically absent. And we use our Here to Help referral form, which when I say Here to Help, it's kind of our brand name for LEAP. So those two terms are interchangeable. And we work very closely with family centers and DOMIS. I have 2 outreach workers at each that provide home visits to chronically absent students and parents. SPEF, when we first get the referral from a school, which again is part of our general Here to Help referral form, which I'll show you, does outreach to the families and to the referrer to get more information. One of the things I wanted to make sure in our referral form was that the form itself did not provide any kind of a barrier. I felt that some of the initial forms that we saw from the state where people were required to have done like a bunch of different things prior to making the referral decreased or could prevent people from making referrals. But when I say that, we still circle back to the school and make sure that they have been the primary point of communication with the family, and we see what interventions they have tried and how we can help supplement the work. It's still the front line still remains with the school. We get referrals. I put DCF up here. When DCF doesn't accept a case, I've done presentations to our local DCF. And if they don't accept a case for educational neglect, they will contact me and let me know so that we can still provide support and services to the families. We work closely with another organization called Kids in Crisis that provides counseling and respite care for families. And recently we've started working very closely with the Stamford Police Department. Unfortunately, there are sex trafficking and labor trafficking issues. So the other thing I just wanted to mention, that Here to Help and LEAP funding is also used to provide foundational supports and tier 1 prevention. So for example, our 10th graders recently received letters that they were going to be excluded from school if they did not have the appropriate vaccines. And this is after our health department and our schools did a lot of work trying to make everybody, providing resources to get everybody compliant. For kids that were not, they sent those to Here to Help, and we were able to reach out to the families, get in touch with them, and get clinic appointments. So we kind of prevented kids from becoming chronically absent by providing that level of support. Slide. I've got 4 minutes. I just talked about everybody. So here's how our Here to Help program works. And I want you to think of this as how it's going to work, since we're talking specifically about truancy here. But it can be, we receive referrals for a lot of different issues. I received one today from a high school because the student is living with the grandparents. The grandparents wanted help with setting boundaries. The 2 other referrals we received this week were for kids. One was a high school student that's chronically absent because they're undergoing a gender change, and there's a lot that goes with that, and they certainly need support. We also get the kind of run-of-the-mill referrals. The kids that's 30% chronically absent from high school is maybe a 2nd-year freshman, and we will go out and do that. Again, the first line is always going to be to call the referrer, get as much information as possible, and then call the parent and do home visits. We meet with the student and the family. Sometimes we'll meet with the student at the school, but we'll provide every support that we can to try to re-engage that family with their child's education. And sometimes that might mean that they need a 504 plan, or that transportation's not adequate. The whole range of possibilities that you all see daily, I'm sure. So are referrals made? We have an online form. Families can refer themselves. We got a lot of self referrals during COVID where families said, you know, my kid's chronically absent because I don't understand how to connect to Google Classroom, or we need a hotspot. And it is, I just saw you look at the clock, it's 10:58. I'm going to stop here. The only thing I just want to emphasize is that at Here to Help, we do what I've labeled a 3-2-3 call attempt, which means that we reach out to families by all 3 modes of communication. When we get a referral, we do text, which could be via WhatsApp, depending on what we know about the family, phone and email. If we don't hear back, we wait 2 days and we reach out by all 3 modes again. If we still don't hear back, we'll go into the emergency contact and say, this is not an emergency, but your name was provided. Do you have updated contact information from this family? So we have had a lot of success locating families where sometimes the schools were unable to. We feel that Here to Help, thank you, Matt, helps expand the bandwidth of our school staff, because sometimes they can only call before 3 p.m. You know, those are their work hours. And at Here to Help, we're there on weekends, we're there on evenings, and we speak multiple languages. Questions? In the remaining, I think, like 1 minute.
You could unmute, or if you want to just put it in the chat.
One thing I'll say that the reasons for chronic absenteeism flyer, I do want to change it. We're using it at the middle school and high school. I'll probably make some changes to it when we start administering it to elementary school students. One of the interesting stats that Matt pointed out, and this was part of the work that I think Todd, I can't remember his last name, did at Harvard, is most students and parents think that their kids miss about the same amount of school as everybody else. And generally that's not the case.
Great. Thank you so much, Matt and Susan. Also, thank you, Lisa, Ed, and Michelle for joining us today. Thank you, all of you, for joining us today as well. We just wanted to give a quick, upcoming meeting update. So here are the dates that we're meeting. We're still really figuring out the topics for these, but right now we're focusing a lot on, we want to focus on LEAP, and some 504 strategies to use as well, pertaining to attendance. So those are some themes that we're working out and working through. Here's also our contact information. We will be sharing the PowerPoint with you. It will be posted on Talk Tuesday along with the recording very shortly. And feel free to contact any of us anytime if you saw a valuable resource or just want to get connected with one of our presenters. But thank you for joining us today.
Thank you.
Great. Thank you so much.
Thanks, everybody.